Checking your breasts regularly helps you know what's normal for you. Choose a time and place to check your breasts when it suits you. Begin by looking at your breasts in the mirror. Keep your shoulders straight and put your hands on your hips. Look at each breast and nipple to check for any changes in size or shape. This includes whether your nipple has sunken or become inverted, or if there's any fluid coming from one or both nipples. Check your skin for any redness, rashes, dimpling or puckering. Now raise your arms and look for the same changes. Next, feel for any lumps or painful areas. Use the flat part of your fingers to gently work around each breast, pressing in small circular motions. Vary your pressure to check the tissue just under your skin, but also deeper tissue too. Be sure to check the whole of your breast area. This includes under your armpits, all around each breast and up to your collarbone. Do this step laying down, perhaps in bed, and then standing up, maybe while taking a shower. Your breasts might feel different at different times during the month, so getting to know what's normal for you is key. Always contact your GP if you notice any unusual changes.